I'm Michelle, and today I want to talk about a condition that's close to my heart and affects an estimated 1 in 10 women and those assigned female at birth. Despite how common it is, endometriosis is still massively misunderstood, underdiagnosed, and often dismissed. If you've ever heard the term but aren't quite sure what it means, or if you suspect you or someone you love might have it, this episode is for you. What exactly is endometriosis? Endometriosis is a chronic inflammatory condition where tissues similar but not the same as the lining of the womb starts growing in places it shouldn't, outside of the womb. These rogue tissue cells can appear in the ovaries, fallopian tubes, the pelvic walls, the bowel, the bladder, and in severe cases, even beyond the pelvic area. The problem is, just like the lining of the uterus, this tissue responds to hormonal changes every month. It thickens, it breaks down, and it bleeds. But unlike a period, this blood has nowhere to go, which leads to inflammation, scarring, and sometimes severe adhesions where organs literally stick together. One of the biggest challenges with endometriosis is how varied the symptoms can be. The most common symptom that we hear people talking about is pain, but it's not just bad cramps. It can be severe pelvic pain, often during or before periods, but also throughout the month. Pain during or after sex, pain with bowel movements or urination, particularly around the time of the period, heavy or irregular periods, fatigue, bloating, digestive issues, and for many, fertility problems. The pain of endometriosis isn't just a bad period. It can be completely debilitating, stopping people from going to work, school, or even from being able to get out of their bed. Here's the frustrating part. On average, it takes 7 to 8 years to get an endometriosis diagnosis. Why? Because symptoms are often dismissed as normal period pain or misdiagnosed as IBS or other conditions. Currently, the only way to diagnose endometriosis is through a laparoscopy where a camera is inserted into the abdomen to look for endometriosis lesions. It's far from ideal, but unfortunately, there's no simple blood test or scan. There's also no cure for endometriosis right now, but there are ways to manage symptoms. Treatment options include hormonal therapies like the pill or hormone injections, which aim to suppress the growth of the endometriosis, pain management using anti-inflammatories or stronger pain relief, surgery, specifically excision surgery, where the endometriosis tissue is carefully removed. This is considered the gold standard for many patients. Lifestyle changes like anti-inflammatory diets, gentle exercise, and stress management could also help some people, but it's really important to remember what works for one person may not work for another. Endometriosis is so individual and treatment needs to be tailored. Endometriosis doesn't just affect the body, it affects mental health, relationships, career, and self-esteem. Living with unpredictable pain and fatigue can be exhausting, and many people feel unheard by the medical system. That's why awareness and advocacy are so crucial. No one should have to fight this hard for their pain to be taken seriously. If you're listening to this and think, this sounds like me, please know that you're not alone. Endometriosis is real and your pain is valid. Reach out to specialists, connect with support groups, and know there are people out here fighting for better care and awareness every single day. Thank you for listening. If you found this helpful, share it with someone who needs to hear it. And as always, you can find me over on Instagram at endometriosis.